All right, well, we've talked a little bit about how we can see cancer in humans, but what about cancer in pets? Skin cancer in pets is not as uncommon as you might think. Joining us this morning is little Snowy. This poor little baby had cancer. Was it of the ears,
Yes.
Dr. Marizzi? Okay, so and you can see that the ears, what did they do? What was the surgery that you did to remove this?
So white-haired animals and animals that have depigmentation of the nose or the skin are very susceptible to skin cancer. And we most commonly see squamous cell carcinoma and hemangiosarcoma.
Are those the same skin cancers that we have as humans?
Yes.
Okay.
So squamous cell carcinoma seems to have a predilection for the tips of the ears in cats and in horses and in white-haired dogs, but more commonly in cats.
I've got a dog that has very light fur.
So I was able to remove the lesions completely by trimming back the ears, and the surgery is curative. So if the surgery is done prior to the cancer spreading internally,
then the animal survives.
The animal survives.
Let's talk a little bit about a sunscreen. You're saying that you can apply these topical sunscreens to our pets, and this is just a Neutrogena. You're saying there's two things we want to look for. What is that?
So you want to apply sunscreen, but unfortunately animals lick. So definitely limiting exposure to the sun and applying sunscreen.
And we want SPF 30 and no zinc oxide, because you said they lick and they'll ingest that and it's bad for them.
Exactly. Zinc can cause toxicity, so you don't want to use a zinc oxide sunscreen that's going to be ingested.
We've got some resource guarding down below here. Two dogs don't want to give up their treats. I just heard a little growl. Okay, well, let's move on to another thing that's big this time of year, flea prevention. Actually, I had to bring my dog into the ER, and he ripped off one of his nails, and they told me it was the first dog they'd seen all day who didn't have fleas. It's really big year-round in San Diego.
Yes, so in San Diego we have 70% humidity and 70-degree average temperature, which is perfect for fleas.
So we want to make sure we're giving a flea medication like this year-round.
Exactly. Unlike other areas of the country, year-round flea control is extremely important.
Well, because if you have a flea allergic dog, one bite is going to send him over the edge.
Right. The saliva of the flea actually triggers the allergic reaction. So using a preventative like these products, and there's a plethora of flea products on the market.
Do you recommend topicals, or topicals are like Frontline that you put on the fur, or do you recommend the ones that they ingest like NexGard?
Either one.
As long as you're giving it regularly.
Exactly.
Okay.
Yeah.
So besides flea allergy, we also have different kinds of allergies, food allergies and environmental allergies.
Right.
So if your dog is allergic to food, that's really difficult to figure out, but there are some foods you can give that are low in or no grains and things like that.
Okay, so that's kind of a simplification. What I suggest is that people do a diet trial. So we use a prescription diet, which is a limited antigen diet, no preservatives, no flavoring sprays, 1 carbohydrate, 1 protein, and they are controlled because they're prescription diets. And there's a bunch of them on the market. This one happens to be a hydrolyzed protein diet.
What does hydrolyzed protein mean?
The protein is split into such a small particle that it can't attach to the mast cell and cause an allergic reaction.
Oh, that's good.
And many of these diets come in canned, dry, and treats.
Okay, we only have 30 seconds left, but I want to get to this end of the table. It's something that I'm very familiar with. If you have a dog with environmental allergies, meaning he's allergic to trees, he's allergic to grass, my dog's allergic to cats, there's really only one way to treat that, and that's to give them allergy shots, but you also want to give this special shampoo here. I'm very familiar with this shampoo. How does this help?
Yeah, so you can apply topical shampoos or mousse or leave-on lotions. Unfortunately, topical treatment only lasts 3 to 4 days.
Yeah, I was told to bathe weekly with this, and it really, I mean, it is amazing. If your dog is always licking and itching and his paws are all red, you've got to get some of this shampoo.
Yeah, and we also have wipes.
Well, I need to get the wipes.
When an animal, it comes in from outdoors, if they're allergic to grass, pollens, you can wipe their feet.
And there are also things they can give them, like anti-itch medicines like this one right here, and there are steroids, but you don't want to keep them on these long term.
Right, so there are new medications on the market. There's one right called Apoquel, and that does not have the side effects of corticosteroids. Injectable medications are much more effective in cats because people have problems giving their cats medications.
That makes sense. All right, Dr. Sue Marizzi, tell us where we can find you.
So we're in La Jolla, at 7527 Draper Avenue between Pearl and Prospect.
This is the Village Veterinary Hospital.
Yes.
Thank you so much for these tips. They're really good this time of year and pretty much year round also in San Diego. Thank you for joining us.
Thank you.